Let's talk about the underlying mechanism of hair loss, right? I mean, the old adage is we have testosterone's metabolite DHT, dihydrotestosterone's coming in. That's causing miniaturization. It's causing the follicle to get thinner and thinner and thinner, and then eventually fall out. Is that the major mechanism that we're dealing with, or is there anything else that's coming in? Because obviously we know low thyroid, maybe cortisol imbalances, maybe poor diet or not good having good protein absorption. What do you think the top three or so mechanisms outside of DHT you think are impacting hair?
Yeah. So what you're saying is obviously very, very true. We're seeing primarily in the clinic, we treat androgenetic alopecia. So that's a diagnosis, right? Male
Right.
or female pattern hair loss. The sensitivity to DHT is what you inherit in those cases. What we found is that there's a lot of things that could dysregulate the hair follicle on top of having this tendency towards male pattern baldness. And it's been revealed, unfortunately, through COVID and vaccination, that you could dysregulate the hair follicles in that
Yep.
way, shape, and form. Poor sleep and nutrition, for sure. Anything that dysregulates your health and wellness can affect your hair. Your hair follicles are the most highly metabolic cell population in your body. They have the highest mitotic rate. So they're very, very sensitive to changes in nutrition and fuel. They're very sensitive to changes in your overall wellness. Sleep wake cycles can dysregulate them as well. Inflammation in the body, inflammation at the scalp can disrupt the hair follicle cycling, and a number of other things. So we definitely want to take a good holistic approach to what's going on with the body. Medications like blood pressure medications, mood modulators. There's so many medications that could dysregulate your hair. We want to keep a close eye on that as well. You asked specifically about testosterone and DHT. We know that's the primary trigger. So for male pattern hair loss, we're always talking about, should we consider an approach to block or inhibit the formation of DHT in the body? And that could be done finasteride or dutasteride. Those are pharmaceutical treatments, of course. Saw palmetto does address it in that way, organically or nutritionally as well. And there are other things that maybe will help block androgen receptors topically on the scalp as well. So that's really, to create a treatment plan, we want to take a look at the whole person and the whole environment, I guess, what they're dealing with, and then put together a plan of action to help protect the hair follicles, maybe with the anti-androgen perhaps, but also what can we do to stimulate the follicles? And there's a bunch of pharmaceuticals and other ways, in regenerative medicine to do that as well.